Hi, my name is Danielle Matias, and I'm here in Cary Medical, Florida, talking to you today about a recent patient that I saw in the office. This patient was a 70-year-old nurse who came in complaining of thumb pain. So most of the time when people have thumb pain, they complain of it kind of right here at the base of the thumb. That's called the CMC joint right here. This patient, again, like I said, 70-year-old nurse, uses her hands a lot. You think about opening meds, a ton of writing, lifting things, but it was getting to the point where she started to become weaker in that thumb. You're not using it as much. It's more painful. She would say that she was losing her strength. Opening jars had become more difficult due to the pain that she was having. When she came to the office, we did what we call a motion x-ray. Okay, so that's essentially an x-ray where she's moving her hand, moving her thumb, and we're looking at how the joint is moving. Is it moving too much? Is it not moving enough? Is it unstable, would we say? Arthritis? We're gonna try to get answers to all of it. So this is her motion x-ray here. So she's kind of waving, but you'll see she'll start to move her thumb here in another view, and you can see how it kind of slides off. Like basically that metacarpal is sliding off of that carpal bone as she's moving it, showing instability. Sometimes it's maybe hard to catch on that, so I took some stills from this x-ray to show you. From this view to this one, like this is sliding off of the joint, okay? So when she's moving her thumb, just doing any kind of normal thing, she actually has excess motion in the joint and it's unstable. And we know that the longer joints are unstable, the more there's that extra force inside the joint, the more it's actually going to wear down that cartilage, leading to osteoarthritis. So she has a little bit of both, a little bit of osteoarthritis, and she has this instability. This is actually a patient who we had previously seen for her low back. She underwent prolotherapy treatments for that, and her back pain was still resolved when she came back in years later for her thumb. So she knows prolotherapy works, her body heals well, and so we made a treatment plan for her using prolotherapy to help stabilize the joint, reduce her pain, increase her function, get her back to doing the things that she wants to do and the things that she has to do for her job. So some key learning points here. Dynamic imaging, motion x-ray is very, very useful in diagnosing patients' conditions. If someone came in, they have thumb arthritis, they have thumb pain, if all I did was, even if it was PRP or even regenerative, if all I did was just do an injection inside the joint, I likely would not help them long term. Let's say I put PRP inside the joint, but I'm not treating any of the other ligaments, I'm not treating it comprehensively. Likely what would happen is they may feel better for a short while, right, in the short term, but likely not have long-term results. So that's why we have to treat the joint comprehensively, again, aiming for those long-term results. And it's not uncommon for patients to return to our office after we've helped them with other areas. We see a lot of patients who, their back pain, their shoulder pain, their knee pain, what have you, has resolved, and then they, might hurt themselves doing another activity or have another trauma, and we see them again for that.